and then you may not see anything at all. Herpes is sneaky because it will disappear completely after it has healed. It doesn't leave scars. Well, if I do blood tests to see if you have herpes 1 or herpes 2 antibodies in your system, and you do, that means you've been exposed to the virus at some point in your life. Does that mean you have herpes? How do you know if you have herpes? How do you prevent yourself from getting herpes? What are signs and symptoms of herpes? And what do you do if you have herpes? Like, how do we manage that? That's what we're talking about today, herpes. So today I got time, I got space, I got opportunity. So we are yet again going to take off the white coat. Today's topic is herpes. How do you know if you have herpes? How do you prevent yourself from getting herpes? What are signs and symptoms of herpes? And what do you do if you have herpes? Like, how do we manage that? That's what we're talking about today, herpes. Say it with me, herpes. Why am I making you say it? Because there's a lot of stigma associated with it. And I want you to know that this is a virus that is very common in the community. That's a Tony Baker, in the community. It's very common in the community, but there are ways to manage it. There are ways to prevent it. There are ways to treat it. So first question that I'm going to answer is, what is herpes? Herpes is herpes simplex virus, HSV. There are 2 different types that we know of, 1 and 2. The interesting thing about herpes simplex virus or HSV-1 is that we commonly thought of that as oral. So when people have cold sores, if you don't know this by now, cold sores are herpes. Should I say it again? For the people in the back, I'm gonna hold your hand. If you don't know this by now, cold sores are herpes. And that's okay. I just want you to know that I know so that you know. But HSV-1 is the one we used to think or typically would think of as oral, and HSV-2 was typically the one that we would think of as genital. Well, here's the thing. Either one can be in either place. I just was talking to somebody the other day who had HSV-1 genitally. I've had people who have had HSV-2 orally. So cold sores are herpes, but that doesn't mean that you have it everywhere. And there is a such thing as auto-inoculation, okay? Auto-inoculation means that you can have a virus in one place because it lives in the dermatomes, which are like the parts of our spinal column. It can be in one dermatome and you can spread it to another dermatome, okay? So if you have it genitally, don't be over here rubbing your eyes and touching your vulva and back and forth, because you can pass it to your eyeball and that was not there before. Similarly, if it's oral, it doesn't mean that it's genital, but if somebody has a history of oral herpes, could they pass it genitally? Absolutely, if they're doing the things and down in the business, okay? So, HSV is, and it's really common. The stats I think are anywhere from 80 to 90% of people have been exposed to herpes in their lifetime. And then a larger percentage will have it orally and a smaller percentage will have it genitally. But again, it is present. Now, how do you diagnose it? Well, the easiest way to diagnose it is to swab a lesion and to look for the DNA within a lesion, within an actual herpetic lesion. Herpetic lesions typically are bumps, but they're open and they're weeping, meaning there's like pus or fluid coming out of them, which is different than a closed bump. Like a lot of people come to me saying like, is this herpes? And it's a like hair bump. Well, it's closed, or it looks like a pimple. It's closed. That's not herpes. The ones that are herpetic are open. They're usually inflamed and red. They can be itchy. They can be painful, and they're wet. There's something coming out of it. Now, once the wetness ends, once that part is over, it kind of crusts over. So you'll see people with like crusties, and then you may not see anything at all. Herpes is sneaky because it will disappear completely after it has healed. It doesn't leave scars. Hair bumps leave scars. Boils leave scars. Herpes don't leave no signs, no traces, okay? It'll be gone. So you can't look back later and be like, oh, it was right here, because it'll be gone. So herpetic lesions, the easiest way to diagnose is to swab an open lesion and get the DNA. Well, what if you didn't have an open lesion at the time? Maybe you had one 2 weeks ago and then the symptoms are gone. Well, you can do blood work. We can do blood tests to determine if you have the serologies, which means that you have antibodies. So like, I'm old, so I had chickenpox. That means I have varicella antibodies in my body because varicella is chickenpox, and my body created antibodies, which is like the counter, a fighter, if you will, to the antigen, which is chickenpox. So this is chickenpox, and my body created these antibodies to get rid of it, and now I have the antibodies around, okay? If you're exposed to herpes, your body creates antibodies to that, then you have those antibodies floating around in your system. Well, if I do blood tests to see if you have herpes 1 or herpes 2 antibodies in your system, and you do, that means you've been exposed to the virus at some point in your life. Does that mean you have herpes? Not necessarily, because you may not ever exemplify it. You may not ever display the virus, and we'll talk about that in a second. And so you may not be able to say, oh, I have herpes, but I have the antibodies, which is why checking for serologies or checking for antibodies is so complex, because I could run that test on everybody and a large percentage of people will have these antibodies. But does that mean all those people have herpes? Not necessarily. And I don't like to overdiagnose. And the CDC tells us, well, the CDC before RFK told us, don't just blanket test everybody for herpes, because you can't say that that person has it and then you just see fear and anxiety. So it's easiest to check for lesions. Think you've had a lesion and then we check blood tests, or you think you've had exposure and we check blood tests, then we can kind of maybe put 2 and 2 together. Oh, you have the antibodies, you had these symptoms, you probably have it. But it's hard to just do blood tests on everybody, because just because you've been exposed to the virus does not mean you have it. Like, I'm not walking around with chickenpox right now, but I have the antibodies, right? It's a different way to experience or understand the virus, but without giving the person a diagnosis. Can people shed the virus without symptoms? Yeah. So the person who has the virus, who actually expresses itself, it comes out onto the skin. It doesn't always for everybody cause lesions. And so can a person be intimate with another person who has no symptoms and get the virus from them? Unfortunately, yes, that is possible. And that's also why it's tricky, because you can't always look at a person and say, oh, you don't have the virus. Like, they could have it and they could pass it. And the next thing you know, symptoms come about. When people are exposed, you could start developing symptoms as soon as a few days to a week after exposure. So like, say a person is intimate with somebody else, they have the virus, they're shedding the virus, that person gets it. A week later, they start getting lesions. It's probably with that person you was just with, especially if it was new. Can a person be exposed to the virus and not demonstrate signs or symptoms until years later? Yep. I've had plenty of people who in monogamous relationships for years and years and years, and then suddenly in pregnancy, say, or at the time when they're really sick, or they have COVID, or they have the flu, and now all of a sudden they have lesions. Yeah, you've been had the virus, but your body was fighting its display. It was not letting it kind of replicate and come out to the skin. But now in this moment of vulnerability, sleep deprivation, increased sun exposure, travel, because it's stressful, or big job change, big work change. Sometimes people will have their first outbreak. And if that's the case, you don't always know when you got it, right? But it's there. Management is typically, if a person has very few, like outbreaks, we call them. Outbreak sounds so bad. Do you remember that movie Outbreak with the outbreak monkey? When people express the virus infrequently, like less than a couple times a year, you can take medication, especially if people know what their symptoms feel like. You can start taking antiviral medication when the symptoms are starting. And sometimes it'll stop it from happening at all, because the virus really replicates in your spinal column and then comes out. But people will often feel when it's replicating because the nerves will be irritated. So they'll have pain or they'll have itching or burning before there's any lesions. And so those people who really are in tune with it can start taking antivirals and they can knock it out before it even has a chance to come out. Others who are less familiar, if the symptoms start, the actual lesions start, they can start taking antivirals, and that'll hopefully help the virus go away quicker than it would have if they didn't do that. And then the people who have frequent outbreaks, say the people who have an outbreak every month with their cycle, well, they may need to be on suppression. So they may need to just take an antiviral daily, one every day until they decide not to do it, or until they want to see if their body is more chill about it, and not, being so active with the virus. So there's ways to navigate, very safe ways. Prevention is really limiting skin contact. So, a condom works if the male has the virus on their penis. But what if it's like not on their penis, at the base of the penis, or it's like, on the vulva or something like that? Condom's not preventing that. So there is a little bit of like the unknown when it comes to exposure. But then I also have people who are in long-term relationships who one person has the virus and the other person doesn't, and they don't get it or they don't get symptoms at any point. So having the virus doesn't mean you can't be intimate with people. It doesn't mean that you can't have long-term healthy relationships. It doesn't mean you can't have kids. People with the virus can be pregnant, they can deliver babies, but they often will need antiviral suppression at the end of the pregnancy, like at the 36 to 37 week mark until delivery, because again, stressful environments can bring about outbreaks. And if there's an outbreak at the time of delivery, a person needs a C-section, because you can't deliver a baby past HSV virus. It can be very dangerous for babies. So if there's not any lesions or anything there, then they're fine. But if there is something there, they need a C-section. So we actually have everybody who has a history of genital herpes start suppression like 36, 37 weeks in order to prevent an outbreak or prevent even asymptomatic shedding of the virus at the time of delivery. Very, very safe. The only time I've ever seen a baby get the virus was the person didn't know they had it and they had an outbreak like right at the time of delivery. And that was not so great. But that was only one time. I've been doing this 20 years. And most, I've had a lot of patients with herpes over the years who have delivered babies safely and healthy. Certainly not a concern that I, tell people to not have a vaginal delivery, more so just being very careful and mindful of what's happening with their bodies. I hope this was helpful. Drop any questions in the comments. If you're concerned about that, go to Instagram, send me a DM. If you have a question, like, subscribe. Thank you for joining. And as always, this is your friendly local gynecologist. Bye.